Perfect Balance Healthcare presents Lick, Stick, and More with your host, Dr. Nandita Koodie. Join me to explore the minds of thought leaders as they share golden nuggets on the impact of faith integration in practice, professional development tips, and innovative solutions to bring you beyond ordinary healthcare. Thank you guys for joining me for another episode with me, your host, Dr. Nandita Koodie. I have with me here today the team from Vola, an amazing solution. If you guys could please introduce yourselves and tell me a little bit about what Vola is and what you guys have to offer to revolutionize healthcare today.
My name's Sean Stodola. I'm the CEO of Vola. And on the phone, we have Molly Wemlinger, who's our COO. Vola is a software that we created that connects providers to laboratories for various types of tests. It gives laboratories, marketers, salespeople access to be able to go and get patients, however they might do that, and connect them to the laboratories and bring them back different tests that could be genetic tests or UTI, it could be blood. All types of different types of testing.
Wonderful. Thank you for that. The reason I brought you guys on is to share with us how we can be collaborating with you guys as pharmacy consultants to utilize this platform as a means to better manage our patients in collaboration with physicians. So let's say I'm a pharmacist who's performing PGX services. Now, obviously, your platform can be used for way more than just PGX. I'm just using PGX as an example here. Can you show us how you can utilize this service to better manage and report data and handle all the billing and all of that, and basically have a personal EMR base that's affordable for an individual pharmacist even to implement in practice?
So as a pharmacy consultant and working with providers and working to connect with patients in and out of the office for testing and for managing some of the needs from a pharmacist perspective, the way that Vola can really step into that is to have a place to see and manage all of the statuses of what's going on with your patients. Having a patient profile, seeing all of the records that are happening with your patients, being able to update their information, and ultimately being able to real time see the results that have reported back from the laboratory so that you can access those to better direct the patient base.
Excellent. Yeah. So let's say a PGX pharmacist is interested in having their patients do pharmacogenomics testing and they don't necessarily have a lab set up or they don't know what solution to use to actually perform the tests. Can you show us how it's possible, or is it possible then to use built-in solutions with Vola to achieve that?
Yes, absolutely. So we have many lab partners that are a part of Vola. So in terms of being able to send lab orders through the system, that is 100% possible for you. So what we're seeing on this order is a unique identifier that's right up top that's going to travel with this order throughout its lifetime. The patient's data is going to show at the top with their profile details. If they have insurance or anything like that, that's all going to show here. And then they're also going to have the questionnaire, the intake that was completed based on the particular type. So for PGX, as an example here, we're seeing a variety of information related to their medications, related to different conditions that may influence a pharmacogenomics test. The test request can be sent over to the lab very simply through digital completion. So we can create the requisition form and review everything that's inside of this packet, add final notes, and click approve. And that's how easy it will be for your partnered providers to send that test over to the lab and for that test to be created so that the results can translate back to you directly through the system.
Wonderful. I think one of the things I really like about this is as you scroll down there, you see there's actually a section to add in the patient's prescriptions, and be able to monitor that as well as their allergies and other important pharmacy related MedRec data as well. And the other thing I noticed is that when you were doing the requisition form, there was a section there for notes that makes it really easy to add in any billing codes associated with the services being provided to send over to the provider as well for billing purposes. So this is a really interesting turnkey solution you have here that has the ICD codes and everything else built in to make it really easy to communicate in collaboration with the physician in a way that we can actually have it be billable and streamline the management of that patient and the interpretation of the tests that are being done by that consultant pharmacist. So thank you for that. So tell me a little bit about, if I was a pharmacy consultant that wanted to take on using this solution to basically create a dashboard of my patients that I'm working with and working up, what services do you guys have to kind of help me to understand how to use this effectively and to where I'm not just being handed a solution and then saying, hey, good luck with that?
So anytime that we set up a solution, we go through an onboarding process with all of our clients. One important thing to know is that there are different access points for the different types of clients. So if you are only offering the PGX test or the PGX test plus 2 others, that piece of the solution can be customized to make sure that you have access to the proper pieces. All of that is discovered through the onboarding process so that you have the right tools at the forefront. We also do conduct onboarding training with the business owners, with those users. And we also offer ongoing support directly inside the system. We have a support section. We do have a help widget built directly into the system so that you can live access our support team that's always available to create tickets and request assistance. And we also have phone support available as well. So we're constantly available throughout your life cycle of being a client with us, from properly getting everything set up to making sure you have the right communication channels open throughout your time with us. So we do have solutions for general consults if you're working with physicians and creating different types of consult types. Chronic care management, we have a solution for that. Some of these tabs are just more administrative style things here, so I'll skip over some of those settings. And then we have the patients, which the patients is actually all of the patients, the listing of patient rather than the listing of all of the orders. So inside of a patient's profile, as you'll notice on the right-hand column here, we have the number of tests that they may have. And then if we open up one of the patient's profiles here, so on Mr. Bob, we can see any of the orders that are associated with that patient inside the system on the right-hand side.
And this is great because you can see not just the PGX orders, and you don't have to go into a separate platform for that, but you can see here if they had a cardiac related order or some other test that you were involved in interpreting, all available from one platform as opposed to having to hop platform to manage the same patient with multiple different issues, you know?
Absolutely.
What tools do you guys have for collecting patient satisfaction feedback?
We do have email functionality directly through the system, and each client has the opportunity to set up custom email templates. That's a great tool to use in terms of being able to consistently communicate with the patient, and that return address can be set up based on your business.
You can see this being so much more, right? How do you envision this revolutionizing pharmacy practice for independent pharmacy consultants?
I think the fact that the pharmacy consultants typically have a base of people they're able to work with or are continuing to build as they're building their businesses. This gives them the ability to kind of expand outside of just that PGX piece. And so it gives them the ability to maybe start working with patients for other types of testings that the patients may need. And so, you know, the ability to be able to do that inside the system, especially if they've already, let's say, qualified a patient for a PGX test or identified that patients would benefit from it. You know, going through, they might see that they have, you know, a certain list of prescriptions that, you know, would identify something else that would qualify for a test. Because even from a pharmacy consultant side, they might not be really familiar with what a cardiac test is, or even a CGX test for that matter. But the system actually has a kind of a questionnaire that can follow through with the patient. You know, they could have a tablet in hand, or the provider they're putting it could have a tablet in hand and actually additionally qualify them for other tests as they go through based on some of the questions that might be asked.
Yeah, absolutely. And even as Molly had pointed out There's even a integration for being able to do CCM. Maybe you're doing a PGX report and you notice that the patient's on multiple medications for diabetes. And, they might be a great candidate for onboarding into an RPM and CCM program, being able to manage this platform for that as well.
Absolutely.
Patient, the pharmacist, the staff member, whoever is utilizing the system, to just really simply go through the intake for any of the tests that are available to that particular user inside the system. And so what you'll notice with this, intake is that it's very simple, very clean, just capturing a little bit of information at once, so that way it's not too much to gather. You could imagine a patient sitting in the waiting room while going through this information. You could imagine a staff member or the pharmacist working with the patient, just kind of simply going through this information. And what it's going to do is, I thought I clicked 6 foot. This is a just very simple way to be able to gather the information needed to generate the test request for the patient. It's going to assist in the qualifications of the patient. There's logic built in depending on the types of questions that you're answering, and the way that you're answering them will guide you through the questionnaire appropriately. So as I answer the question, it's going to guide me through some information related to the various types of tests.
Molly, you owe me 37 years and 30 pounds back to my life, okay? What assurances do we have that this isn't being sold for people trying to collect this valuable data? Because data mining is a huge thing right now.
Vola, as a company, we are certainly the ones that are hosting this software, and at the end of the day have the data within our control from the databases. Our customers do own that data, and there are terms within our contracts in order to request information related to that data or exports of that data, et cetera. It is not something that is ever sold or utilized outside of your own usage of the data inside the system.
Perfect. So do you happen to have a sample test with you that we can kind of run through as well?
And so real quick, the last section, we do have the option to collect the e-signatures from the patient as they're creating any requests in here, or if they're working with the pharmacist while collecting that order as well. So this is just a sample result that we have with the information that is presented for the pharmacogenomic test result.
What's great is your solution does a really good job of being able to store all of this information and be able to refer back to it and build upon it for future tests as well.
Yes, absolutely. So once a patient is added inside the system, even if they're added for one particular test, their profile then lives on the system. So being able to go back to that patient's profile, determining at the appropriate time if there's a different test that may serve the patient well, maybe based on an analysis of the initial results, you might consider something else that has either come up or is necessary. A very simple way to get in touch with us is to come out to our website, which is vola.app, vola.app. On the homepage and throughout the website, you'll see an option to schedule a demo on the upper right-hand corner. And it's as simple as submitting the request directly right there on our website.
Excellent. Well, thank you so much for this. It's been just delightful to explore this with you and to see how we can bring to light the solutions that we have in collaboration with yours to really help to bring patients to their health outcomes that we're looking for. So thank you so much for your time and for sharing this wonderful solution with us so that we can have a means to better serve our communities.
Absolutely. I think it's great what you and other pharmacist consultants are doing to better tool patients and providers and really kind of flesh out the life cycle of the test and give patients the time and attention that they deserve.
Thank you so much. I hope you guys take care and stay safe.
Thank you.
Thank you.
Thank you for listening to this episode of Lick, Stick, and More. Subscribe and follow us on YouTube and all the social media sites at Perfect Balance Healthcare, or visit us anytime at pbh.life.